So we're talking about different, the dollar per visit and maximizing the dollar per visit and creating value, making sure there's value. So we're not just talking about charging people without bringing value, just trying to maximize the dollar per visit. So of course the first objective is to maximize your exchange of time for money. Make sure you have all the systems in place to fill your time for money. And then after that, the next level is maximize the money per time. And there's several ways of doing that. There's different strategies. And one common way is personal injury, but that's one common way. And then there's different, medical combination models with pain management and modifications of that. But specifically what we're talking about is more cash-based right now. And so when we talk about the models, and we talked about, the primary versus secondary payment factors. And when I say primary versus secondary, I'm talking about, the thing you make most of your money on, the chiropractic visit and the treatment, versus secondary, which might be nutritional supplies and pillows and orthopedics and things like that. And in my experience, what I found is that most chiropractors never really learn or have the skill set to maximize their time for money. In other words, they don't fill their practice with the most profitable. I mean, number one, they don't fill it with bodies. And so they typically start diverting and start chasing a lot of other things and trying to sell other things. And you'll never make as much money going after pillows and things like that, and supplements and etc. Braces and all that, versus maximizing your time for money for what you do the best, which is the treatment. I mean, let's face it, it takes less than 3 minutes to treat a patient, and if they're paying, $30, $40 for just an office visit, go ahead and multiply that out. Imagine, filled your office every 5 minutes for the hour, and you're making $40. Well, 2 times 4, that's pretty decent money per hour, and that's the first goal. So the second component is, and then what I've always learned is, especially if you want to model your office, if you're going to model your office, like with associates or open offices or train people, you have to be very careful about all this peripheral stuff you do, and especially what the doctor does, because it just gets it that much more difficult to replicate and model. So I'm always paying attention to, what I can do. If I can't do something to maximize my time for money, I don't bring it into the business. If I can't replicate it in a model, I don't bring it into the business. So I'm paying just a tremendous amount of attention to that, and I'm not being sidetracked with, selling a few pillows here and there. So having said that, so overwhelmingly you'll see, and if you went to the Chiropractic Economics survey of the ratio of income and where chiropractors make their income, you'll see that the supplements and things like that, all that pillows and all that, that's a very, very low percentage. And if you looked at the same chiropractors, like they'll show the average chiropractor seeing maybe 87 visits a week, and the ability might be like, say, 200. Well, that's 113 visits a week that chiropractor's not seeing, but he's putting all this kind of attention on selling a freaking little pillow, where he could have increased his skill set and knowledge and seen an extra 113 a week. It takes 3 minutes and you make $40, $50. So from an economic standpoint, it's crazy. And then also I've seen that there's a tremendous amount of distraction. The more of this peripheral stuff you bring in, it starts being a major distraction and an inhibitory factor to actually create high vertical volume with the primary purchase vehicle. So that is what I've personally experienced and seen and over. So that's why my model, we had, and I'll tell you the truth, we had pillows and lumbar supports. I gave them away free. I didn't even charge for them. And the reason, and we didn't do supplements, and the reason was that is I wanted a highly reproducible machine. And that's when I brought the doctors in and trained, I want it streamlined and very highly producible, and simple, and also to where they stayed focused and not distracted by all these other widgets and gadgets, which will definitely decrease their capacity level or their ability. So the very first thing is to maximize your time for money. That's number one. And then, so the question is how do you start increasing your money per time. And we're talking specifically about cash. There's many ways of doing it with all these with different models, but we're talking specifically about cash. So that's why I always say that I always recommend is just kind of minimize all the secondary stuff, because you can always do way better with your primary, and it's much more simpler and it's much more direct and focused. So an example would be, and you always watch the numbers. So what we do is we always increase the what you charge. What you charge is cash. Should always be based on your present business state. So if you're doing low business and you have low referral, well, you shouldn't be charging that much, because you need to get bodies. You need to get warm bodies in there. And so what I always say is look at your referral rate and your patient visit, your average patient visit. And when you have what you would call satisfied as, then you raise your fee. And anytime you raise your fee, you always do it incrementally, very, very little. And you'll have marginal people that'll slough off. It won't be that big of a deal. And remember also, what's really important here is not just your referral rate, because we're saying trust. What we're saying is they're buying in. They're accepting that fee for that service and that trust. That's what's happening here. So we're going to look at the referral. We're going to look at the referral rate. We're going to look at the patient retention. And then we're also going to look at where the patients came from, because remember, we should have a disproportionate number of patients, new patients, coming from the introduction, active referral, passive referral category. Most chiropractors that show up, and want consulting, coaching services, we evaluate all of their new business, and overwhelmingly, 50 to 70% of their business is coming from what's called cold call type of marketing, the absolute worst type of business you can get. So those are the factors that tell you trust, that people are buying what you have to sell, they're accepting what you have to sell, and you have high trust categories. Introduction, active referral category business, and that should definitely be over 50%. Your patient retention, now the national average is 18, so you have to decide what you're going to be, what your belief system is, what your value system is. But I would not raise the fee if your retention rate was below average. You need to work on your skill set and knowledge base of retention. And what I would recommend is 25. I'd say 25 is a good number, 25 patient visit retention. If you stay at that number or higher, then that's a safe number to increase your fee, and it'd be negligible. And the same with referrals. Your referral rate should be about 70%. So hopefully you can see that if you have good systems and you're showing to be the majority of business you're getting from high trust categories of introductions, active and passive referrals, those are marketing systems. Those are the highest form of trust in these categories. And then, in other words, they're willing to spend more money. They're already coming in willing to accept what you have. And you know this if you practiced any time at all. A patient who comes in from a referral, how much easier it is to communicate with them and how much more accepting they are and how much more willing they are to pay versus somebody who's doesn't know anybody and they came in from a coupon. These are big differences if you've practiced at any time at all. So I would make sure that is over 50%. And then if your patient retention was over 25, that says that you have above average skill level, knowledge and skill level. And if your referral rate was over 70%, I'd say all three of those markers are indicators to raise your fee. And when you raise your fee, it's not a big leap. It's a marginal leap. But that's how you continue to raise your fee. Well, if you did that and it happened, let's say every 6 months, 1.5 to 2 years later, you're coming up pretty good in your fee category, and you're not losing business. Now, I just want to say one thing, that you have to be aware of a law, and you have these are the factors that will determine how you do that. But you need to be highly aware of a business concept called it's called inverse. Let's see, I forget the name of it, but inverse proportional spending. But essentially, what it means is people don't spend on a bell curve. What happens is as people spend more money, the number of people will go down. As the fee goes up incrementally, the number of people that drop out drop down incrementally. Now I'm talking incrementally. So if you raise your fee incrementally, then the number of people that will accept it will drop down incrementally. And it'll always pay off relative to, and then you fill the void. Now you have the void of these people, remember, of your time for money, and you fill those void with higher paying, high trust candidates. That's how you do business. And that's how you can have a really strong, healthy business and finances and maximize your time for money. And now, again, we're just talking specifically about the cash category. We're not talking about moving the business into a higher profitable category like personal injury. In other words, doing more personal injury or including, spinal decompression. That's a higher dollar category, or including a cash category, or including maybe a pain management type. So we're not talking about that right now, because those are definitely options. But that goes back to your belief system, your business model, and do you plan on replicating it? The ease of replication with other chiropractors. So those are the factors there. But anyway, the inverse proportional law, basically what happens is there gets to be a point, and it's the tipping point, that it's no longer a linear progression as you increase your fee. In other words, it's not linear. What happens is it's inversely proportional. You will hit a number that it drops off. And so you got to be really, really in tune with that number, because if you go, now it's easy to drop that off if you go too big. If you have too big of a price increase too fast, or it's too close together, or let's say your statistics don't support the trust. In other words, your percent retention, your active referrals, and your percentage of people from high marketing categories, introduction, active, passive referral, high trust categories, if those aren't going down also. So we're going to say if those go up. So you increase it just a little bit, marginally, hold it out 6 months, do it again, make sure it stabilizes, do it again. And that's how you continually go up in your prices. Now, you shouldn't be doing this at all, remember, if you haven't filled your time for money. So it goes back to either increasing your retention or doing better marketing system to maximize your time for money. That's what should happen first. That's the very first thing. Then you go to maximize your money for time. And then after you've done that, then you go to leverage your time. That's the sequence of maximizing in your skill set and knowledge to continually to grow in your revenue and finances and your value for a unit of time. And so remember the inverse proportional law, so you have to be real careful to watch for that thing to dip off. So if I raise my fee and I see a significant number of people start dropping off disproportionately, then I'm hitting that number. So I've either got to change the value proposition, in other words, what they perceive they're getting relative to the cost. But here's what I can't do. I can't just keep that. I got to be aware there's a cliff. I got to be highly aware there's a cliff. So I got to change the value proposition if I want to do that. In other words, create more value relative to what I'm asking for monetarily. That's the value proposition. So these are the factors to consider with raising your fee.